A warm welcome to everyone who's joined us for this webinar, the Global Glyphosate Study, the most comprehensive study on the world's most used pesticide ever, which is organized by the Health and Environment Alliance, HEAL, in collaboration with the Ramazzini Institute. And today we're going to have lead scientists who will present the ongoing Global Glyphosate Study. My name is Janan Jensen. I'm the Executive Director of HEAL, and it's a real pleasure to have several hundred people from all over the globe here for this event today. I'd like to share a few housekeeping rules as we get started. The webinar will be recorded. It will be posted on HEAL's YouTube channel after the event for easy sharing, and the webinar and discussion will take place in English. We're really excited to have live interpretation in Spanish available today. And as you will see on the screen, the slides will show how you can get into the interpretation channel. Unfortunately, we will not be able to answer questions in Spanish. Participants will have the opportunity to ask questions in English using the platform's question and answer box. And we have foreseen time for this at the end of the webinar. So why is HEAL organizing this webinar? HEAL has been active on glyphosate for many years in raising awareness, engaging our health member organizations such as the European Cancer Leagues, and carrying out advocacy and public campaigning with other NGOs. We see it as an opportunity for disease prevention by reducing exposure of toxic pesticides, and glyphosate in particular. Health harm is a real issue affecting real people, and an increasing number of glyphosate victims are being compensated by the courts. More than 100,000 people have filed a lawsuit against Monsanto, now Bayer, in the US, alleging exposure to Roundup causes cancer. So far, 3 cancer lawsuits have gone to trial, with juries returning verdicts of $2.5 billion against Monsanto for compensation. There's also growing public and political support. The European Parliament in 2017 called for a phase out of glyphosate by the end of 2022, and a successful European Citizens Initiative signed by over 1 million citizens also demanded a ban on glyphosate. Today, there is a request to renew the reauthorization that expires at the end of 2022 in the European Union. And the reassessment of glyphosate currently underway is a real opportunity to bring in new evidence. And that's why we're really excited today to host this webinar with the Ramazzini Institute and 2 of the world's leading experts. So now it's my pleasure and honor to introduce and welcome our 2 speakers. First of all, I'd like to welcome Dr. Fiorelli Pelboggi, who is the scientific director of the Ramazzini Institute, where she has worked since 1981. Her research interests include short and long-term toxicity studies on chemicals and physical agents. And Dr. Pelboggi has also authored more than 150 papers in peer-reviewed journals. She's been invited as an expert on meetings of the evaluation and safety of chemicals in the European Parliament, in the European Commission, and in the European Food Safety Agency. She was also invited as an expert for experimental in vivo studies at IARC and WHO. And she was among one of the experts who defined the IARC priorities from 2019 to 2024. So welcome to you.
Thank you to give me this kind of opportunity to be with all these people. Thank you.
It's a really great pleasure to have you. So then I would like to go to our second speaker for the panel discussion, and that's Michael Antonio, who is a reader in molecular genetics and head of the Gene Expression and Therapy Group, Department of Medical and Molecular Genetics at King's College London School of Medicine in the UK. He has 40 years of experience in using genetic engineering technology, including genome editing tools, in the investigation of gene organization and control, with over 130 peer-reviewed publications. Dr. Antonio has taken an active interest in the safety of GM crops and their associated pesticides, specializing in the use of molecular profiling, omics methods to assess the potential for negative health outcomes. So welcome to you, Dr. Antonio.
Thank you very
And I
much.
hope
It's an honor to be here.
Great. So now I would like to hand over the floor to Angeliki, who is HEAL's Senior Science Policy Officer. She's leading this work at HEAL, and she will be moderating the presentation and panel discussion today. So sit back and enjoy the presentations. Thanks.
Thank you, Janon, and good afternoon, everyone, or good morning to those on the other side of the Atlantic. Welcome to our webinar. I would like to start with a short background on glyphosate. So glyphosate is registered as a phytotoxicant and antimicrobial agent. This means it is toxic to all kinds of plants, including trees, as well as to certain bacteria. So glyphosate-based herbicides are the most popular pesticides in the world. They're used in agriculture or normal crops, but also on genetically modified crops. So right now, they're detected in farmers and workers that they use the product, as well as in people living close to agricultural areas all around the world, but also in general population, as they're found as residues in food, and they're used in weed management of public areas and green spaces. So exposure to glyphosate has been linked to a wide range of adverse effects in humans, and maybe the one that raised public concerns, was that in 2015, the International Agency for Research on Cancer, IARC of the WHO, classified glyphosate as a probable carcinogen. This was based on human epidemiology and animal studies, as well as data on the cancer mechanism. So this hazard class should result in non-renewal of glyphosate in Europe. However, in the EU, member states and the EU's agencies, European Food Safety Authority and European Chemical Agency, concluded that glyphosate does not cause cancer or any other health hazard or risk to humans. So as a result, in 2017, the glyphosate license was renewed in Europe, but only for 5 years, in comparison to the 15 years that usually pesticides are renewed. Now, during this time and for the years to come, several pieces of evidence on scientific misconduct came into light. For example, on the analysis of the available scientific evidence by member state authorities and the EU agencies, but also from what is known as the Monsanto papers that were released during the US litigation cases. And these papers revealed malpractices committed by Monsanto at the time, such as paying scientists for ghostwriting scientific literature to assert the safety of glyphosate, as well as hiding concerns connecting glyphosate to cancer. So all of this raised concerns from the general public, as well as we heard, the European Parliament. And right now we are in the situation where the assessment of glyphosate has started in Europe again. Last summer, the industry consortium sent the application for renewal. And the first step in the procedure has been finalized, as the 4 member states in charge this time of the assessment of to assess the dossier. Based on the studies provided by the industry, they have concluded that glyphosate meets the approval criteria, is non-carcinogenic, and causes no harm to human health. So, but the assessment procedure is not final, and right now, additional studies investigating the toxicity of glyphosate could help in the process. These studies, however, they must go beyond the classical toxicity studies and should be free of bias. Therefore, this should be performed by a different entity than the companies that have a commercial interest to place their products in the market. And such a study, a very important study, is the Global Glyphosate Study. And I'm very pleased that we have today here Dr. Fiorella Belpoggi to present in detail the study, followed by a scientific discussion together with Dr. Antoniou. So Fiorella, the floor is yours.
Thank you very much, Angelique. I will try to share with you my presentation, and I am honored to be here. And I am pushed by the urgency to produce and publish the data of our global glyphosate study that is now still ongoing in our laboratory, but one part of the study is ready, and we are really eager to publish it in collaboration with our colleagues of other laboratories around the world. So why we started this study? Because there were some questions. Have glyphosate and glyphosate-based herbicide been tested at currently acceptable daily intake and real-world levels of exposure? So the answer is no. Does glyphosate in this formulation have different effects? We suspect that they have a different effect. And what are the possible adverse effects of glyphosate-based herbicide other than cancer? Because we always forget that health, yes, we have serious disease like cancer, but there are a lot of non-communicable diseases, chronic diseases that affect population during all the lifespan. So in order to answer to this important question, we started in 2016 a first stage of a pilot study that had the aim to assess a lot of endpoints. And just in 2019, we started a long-term study. So we worked with the partnership, very qualified partnership, the University of Bologna, the King's College London, the Istituto Superiore di Sanità, that means the National Institute of Health in Italy, the Ospedale San Martino in Genoa, Italy, and the Mount Sinai School of Medicine in New York, and the George Washington University, who is working on this field from more than 10 years. And the stage one of our study had the aims to assess the methodology for conducting a GLP, good laboratory practice, long-term integrated and comprehensive study that is the one that is now ongoing. But it has also the aim to study in the same pilot assessment the endocrine system across different life stages of treated Sprague-Dawley rats at the human equivalent US acceptable daily intake of 1.75 milligram per kilogram of body weight. So we tried to build a human equivalent experiment. So the first study, the stage one study, had two groups, treated groups, and a control. The glyphosate was administered at the libitum in the drinking water, and Roundup was administered at the same glyphosate equivalent dose that is the same of the ADI in the United States. So what we have seen, as you see, the study, as I said, was trying to reproduce a human equivalent situation. And what we cannot do on the human population is to have samples during the different period of the development up to the adulthood. So we had a first cohort that we call the 6-week cohort, in which we took samples at PND 70 and another cohort at PND 120 that is equivalent to the young boy and girls. What are the different key characteristics to classify a compound as an endocrine disruptor? As you can see here, but this is not the floor to explain all these different endpoints, but we had in our pilot study under observation all these different endpoints in order to, first of all, understand how to analyze glyphosate and the glyphosate equivalent of Roundup in the biological liquid like blood and urine and the different tissue. And as you see, the endpoints evaluated were about 15. So some of them were the endocrine sensitive endpoints. And for what we could see in the in-life part of the study, that means how many pups, how many abortions during the pregnancy, and the anogenital distance, the vaginal opening, the first estrus, and the balanoprepucial separation. We observed the in-life parameters that could give us information to assess the endocrine disruptive activity. But there were also the parameters that we studied at the end of life, and this was done through peculiar and specific examination from the hormone and the methodological analysis to the sperm analysis and the histopathology and transcriptome analysis. So the study was a pilot study, but it gave us a lot of information. First of all, what we see is that the anogenital distance at PND at the postnatal day 4 was significantly increased, both in Roundup treated males and females, and in glyphosate alone treated males. And the age in parallel, and this is very important because it's the confirmation of this result, the age at first estrus was significantly delayed in Roundup exposed group. Other results regarded the hormones, and hormones in females, as you see, the testosterone was statistically significantly increased in female. And we had the increase of hormones or decrease in some other parameters also in males. So this analysis confirmed that in our experimental condition, the glyphosate and Roundup were both endocrine disruptive agents. So other results were also analyzed, some regarding the renal, the kidney in DAMS, and we found renal tubular degeneration and focal minimal inflammation in all DAMS that were perhaps affected more than the PAPs because during pregnancy, kidney are already stressed, and the stress of a toxicant increased the effect. We found effect on the microbiomes, both for glyphosate and Roundup in stools taken at the postnatal day 31. And we found a lot of differences in other parameters like phosphate, inorganic phosphate, creatinine, total protein, lymphocyte count. We published the study in 4 papers directly from the Ramazzini Institute, but we have other publications with our partners. Dr. Michael Antonion and his staff published a very nice paper on metabolomics and on the sample of this study, and the same was done in a comparative toxicogenomic study between glyphosate and Roundup herbicide. And in parallel, our colleague Jia Chen from the Mount Sinai School of Medicine in New York, studying a cohort of mother and their offspring, found that anogenital distance of the young girl was affected by the exposure of their mother to glyphosate and Roundup, so confirming that our results are predictive in terms of endocrine disruptive activity. So we have the stage 2 of the study now, and what is the aims to go in deep on the results that we have already had with the pilot study, but this time with the GLP design that could be taken as a reference for the risk assessment. And the study is involving 4 different doses, 0, 0.5, the acceptable daily intake in Europe, then NOAL that is 50, and the middle one. And this is valid both for glyphosate and Roundup compared to a control group which had drinking water alone. So the design of the study is including the parents, the breeder generation, and from this breeder, we randomized our animals in order to have no more than 1 brother and sister for each group. And we have 2 arms, one for carcinogenicity that is still ongoing as in life phase, and another one for the so-called arm B, where we study the different part of the period of the 90 days where other parameters out of cancer could be monitored. So why we need to publish this data before the end of 2021? First of all, because no further robust data were published during the period from 2017 up to now. So glyphosate in this situation can only be renewed because there are not indication strong enough to find the route to ban him or to rule him in a more restrictive way. So the results should be published before the end of 2021, when the observation to the assessment group on glyphosate conclusion could be performed. Our data of the arm B, I underlined that we have not the carcinogenicity study ready, It is the endocrine disruptive and other parameters ready to be published after a strong effort to produce all the analysis. We will have the multi-generational effects, the neurotoxic effects, the endocrine disrupting effect, the prenatal developmental toxicity effect, and the effect on microbiome. All that could be done with the partnership of the colleagues that already worked with us for the pilot study, that already assessed the method to do all this study together and to produce robust data. So what is the cost of all that? Human cost and material resources. It could be a huge amount of money, but we have to consider that the world study is costing to the Ramazzini Institute about 5 million euros, and that the COVID infection pandemic affected our fundraising activity very much, because our more than 30,000 fellows, volunteers, are reaching every year around 1 million euros, and they are blocked by pandemic. I think also this summertime, that was one of the most producing period, and perhaps up to the end of the year. So we need a global effort, not only the Ramazzini Institute effort, and we are sure the regulators, governments, and the general public could have a good benefit from the publication of our study, because if not, probably the glyphosate could be reauthorized, and we don't know if it is carcinogenic or not from our study, but we will know if it is really safe when we consider endpoints other than cancer. So whatever will be our results, they will be solid, independent, and obtained by a shared research project with the involvement of multidisciplinary colleagues from all over in the United States and Europe. So I really thank you very much for your attention, and I thank you if you would move with us in order to have a big crowdfunding. All together we can do that. Thank you very much for your attention.
Thank you very much, Dr. Belpoggi, for this presentation. Before we start discussing it, I would like to give the floor now to Dr. Michael Antoniou. Michael, the floor is yours.
Thank you, Angeliki. And thank you, Fiorella, for an excellent summary presentation of the study so far. I just wanted to briefly summarize our findings of studies that we've done collaboratively with Dr. Belpoggi at the Ramazzini Institute. She kind of alluded to them on one of her slides. But our joint efforts there have provided some insights, further insights into possible toxicity from both glyphosate and from Roundup. In one of the papers that she showed, which we published back in January this year, where we took female rats and fed them 3 doses of glyphosate and 3 doses of the typical European Roundup formulation, and then use various molecular profiling methods to look at the gut biology and the internal blood system. And what we found was that we proved for the very first time that glyphosate and Roundup can indeed inhibit a key metabolic pathway in gut bacteria, what is known as a shikimate pathway. The shikimate pathway is the pathway that is inhibited by glyphosate in plants, which is how it acts as a herbicide, as a weed killer. And what we showed here was that actually the very same type of biochemical inhibition can take place in gut bacteria, which can have major repercussions regarding gut health. But also, of course, we have to remember that bacteria in the environment also have the shikimate pathway. So there can be, our finding has repercussions also for environmental soil health as well as gut health. But over and above this, what our findings, our key findings from this study was that even at these European Union acceptable doses that we investigated in this study, we found very strong evidence using metabolomics, molecular profiling of the biochemistry. We found clear evidence of oxidative stress in both the gut and the blood. The animal was being subjected by both the glyphosate and even to a greater degree by the Roundup formulation to oxidative stress, which is not a good thing because oxidative stress can damage molecular structures, cellular structures, and organ structures that can lead to severe illness, including cancer. And in the other study that is currently being revised for peer review, but is posted on the bioRxiv preprint website, what we did, since the first study showed that oxidative stress was probably happening to the liver, the oxidative stress was identified in the blood biochemistry analysis, indicated that the liver was being subject to toxicity. We did an in-depth molecular profiling of the liver from these very same animals. And indeed, we found that there were major changes in the gene expression pattern, as well as evidence of histological damage in these animals, especially the Roundup treatment group. Interestingly, we were able to identify changes in gene expression patterns that were reflective of oxidative stress and DNA damage in the livers of these animals. And and this was true for both the glyphosate treatment group and the Roundup treatment group. So taken together, what the results of these studies are showing is that, first of all, the power of using a multi-omics molecular profiling method to more accurately and sensitively highlight potential health damaging effects from these chemicals. Because in this study, we compared these molecular profiling methods to the standard histology and biochemical measures that regulators currently use for health risk assessment. And we found that what the regulators use is inadequate, whereas in showing sensitively negative health outcomes, whereas the molecular profiling methods clearly showed worrying outcomes. The key about all these findings as well is that they are predicting. Just to link into the Global Glyphosate Study, what our studies are shown, because they're only 90 days, we saw these signs of negative health outcomes in terms of the gut, as well as the physiology of these animals, after just 90 days of treatment, predictive of possible negative health outcomes in the long term. So this is why the need now is for the Global Glyphosate Study to build on this, as Dr. Belpoggi was mentioning, by extending the study to see whether the signs of ill health that we see at 90 days do accumulate to serious ill health, including cancer in the long term. Thank you very much.
Great, thank you very much, Michael. Fiorella, if you want to join us, we can start the discussion panel. Great. Yes, hello. So this is a very comprehensive study indeed that you started, and preliminary results, they're so maybe a little bit different of what the member states have just announced like a couple of weeks ago, that there is no health concern for glyphosate. So maybe we can start the discussion by the focusing on the benefits of the design of the global glyphosate study. So evidently, this is, as you explained, this study is a little bit different than the classical long-term toxicity studies that are required by regulators during the safety assessment. So could you explain again, what is it so special about this design from the point of view of human health? Like you explained to it, but you know, it would be good to give some emphasis to it.
So I think that there are two prerequisites that are very important. The first one is that this year we are celebrating 50 years of activity as Cesare Maltoni Cancer Research Center in our institute. So we have a huge experience in monitoring also very small fluctuation in the incidence of the different chronic diseases. And the second one is that we are independent. The Ramazzini Institute has no business, no interest into the field of pesticide or chemicals. We have a great interest from long time into the safeguard of human health. And we proved over the time that our study were never denied. Every time we predicted the hazard related to the use of a chemical, we were never denied. So these are the two, I think, very important prerequisites. But then there is also an important characteristic of this study, that as Dr. Antonio was telling, we can compare the biomarker that we will find in the first 90 days of life with the outcomes that we will have at death. So what other disease could be predicted studying the early life? And this is a very important issue. And another issue, let me say, is that if we lose the occasion to present the data this year, we probably will lose the occasion to regulate glyphosate in Europe based on new, robust scientific data produced by very qualified scientists, independent, around the world. And this is a very original occasion, important occasion, that could give to all the global population a huge benefit for the future, and also a message. If industry do not invest money into, or industry, but also institutions, do not invest money in studying in a sensitive way chemicals that are spread around us, the Ramazzini Institute, with the help of citizens and other independent scientists, can do that. And we are open to perform studies on uncertainty related to different chemical and physical agencies, because we have the know-how, we know how to do that.
Thank you, Fiorella. Michael, do you want to add to this on the design of the study?
only to say that it's really brilliant for me, brilliantly designed study. It goes beyond what regulators normally require, because there's a prenatal component, there's a multi-generational component, and looking at all the way through to death. And crucially for me as well, one of the things that regulators to date have completely ignored, neglected, and for me shamefully neglected to do, is to undertake long-term toxicity studies with the Roundup formulations and not just glyphosate alone. So why is this important? What farmers and even people in their gardens use is not pure glyphosate. The Roundup formulations that are bought and used are mixtures of glyphosate and many other chemicals, collectively known as coformulants or adjuvants. These coformulants or adjuvants, which are rarely disclosed by the manufacturer. On the package, you will read inert additives as if they were non-toxic. Whereas there is a wealth of evidence, including in our very latest studies that I alluded to just a short while ago, that clearly show that the formulations are more toxic than glyphosate alone. In other words, the additives, these coformulant additives, are toxic in their own right and may further enhance any toxicity of glyphosate alone as well. So I think the other strong point about the Ramazzini Global Glyphosate Study, alluded to by Dr. Belpoggi, is that for the first time, we will have side-by-side comparison of glyphosate alone and two typical formulations of Roundup, one European typical, the other United States, taken long-term. This is something which is sorely missing in the scientific field. We already have some evidence that even incredibly low doses, work conducted by my own group, published back in 2015 now, and 2016, that rats exposed to an ultra low dose of Roundup after 2 years showed clear evidence of non-alcoholic fatty liver disease, a very serious condition. And our latest study builds on that by showing that the Roundup caused liver lesions, including fatty liver lesions and necrosis. So this again highlights the importance of looking long-term with the Roundup formulations as well as glyphosate alone. If the regulators don't do this, they are failing in their duty to conduct, to evaluate things properly and better protect the public,
Yes, thank you very much. I very much agree on this. So to highlight that such a study is not currently included in the assessment of glyphosate and highlighted. Yeah.
Correct.
Exactly. So one more question, one question in relation to the biome that you mentioned. You mentioned the impact that this could have on human health, like to the alterations that we see in microbial communities, and you also mentioned that we have the different techniques to look at it, the multi-omics profiling. So is it something is this important for human health assessment, risk assessment, and should be taken into account what would be what would be the consequences of human health, like based on these studies?
I think again what regulators are failing to do is to come of age. They are dragging their feet and not acknowledging the power of using molecular profiling omics methods as part of health risk assessment following treatment of animals with chemical pollutants to see the outcomes. I think what our studies are showing is just how insensitive the standard histology and and blood and urine biochemical measures can be. Because whereas they failed to show any effects, our molecular profiling methods, especially metabolomics, but also transcriptomics, gene expression profiling, they are showing effects, clear effects, and with which can be taken clearly as signs of toxicity with long-term health consequences. Hence the need to extend these studies in the Global Glyphosate Study. So I think again, this is the importance of using molecular profiling for me cannot be under or overemphasized. And the fact that regulators say, oh, well, they need validating and we don't know, etc. This is just excuses. Or the whole world of science, including medicine and diagnostics, has been revolutionized through the use of molecular profiling omics methods. So why are they not embracing these technologies to better evaluate, more sensitively and accurately, and evaluate the health risk possibilities, health risk measures from chemical pollutants such as glyphosate and Roundup? This is the question that they're not giving an answer to right now.
Yes, thank you very much, Michael. Fiorella, yes, the floor is yours.
Thank you. Just I would add a note on all that. Some years ago, we were proposed to receive funds in order to build a new molecular biology laboratory for doing what Dr. Antonio is doing so well. So at that time, 10 years ago, I refused and I said, no, there are already very good scientists that can do that with a lot of experience. What the Ramazzini Institute represent as an excellence compared to the National Toxicology Program, I have to say that we have done a proportional number of studies with very important results. What we are able to do is to reproduce the human population situation, environmental situation, in experimental animals, avoiding bias and producing samples that could be analyzed by laboratories around the world with a lot of experience in the field. And this allows us to perform such a study with more than 5,000 animals with this small amount of money, because the same study in other laboratory could cost the double or more. But everyone should be expert in its own real expertise. And I think that I am a good experimental animal scientist, and Michael is a very, very good molecular biology scientist. So the prerequisite for the next future study should be multidisciplinary team. So only multidisciplinary teams can produce valuable, robust data. If not, things are always comme ci, comme ça, let me say in French. So this is also a very good quality of this study, that is multidisciplinary.
Exactly. I couldn't agree more. We have to take some questions from, or some more questions from the audience. There is some, let's say, technical question. For example, it says there's one question whether you tested the rat show, if you were sure that it was free from glyphosate. And then there was one that you just answered, is in that why do you call it the most comprehensive study? But I think just now saying that you have 5,000 animals and looking all these parameters, I think this is an answer. Yeah, but yeah.
I can address that question on contaminants. Indeed, we had in the study that I did with Fiorella, we had our feeds specially formulated, and we did a comprehensive chemical analysis of the feed, and we showed that there was no glyphosate or no detectable glyphosate or other pesticide residue contaminants in that feed. This is why we're very confident that the results we got were clearly due to the intervention of the Roundup and glyphosate, and not due to contaminants. And I think that's why we saw so clear results, because our baseline control group was really clean. It meant the differences we saw were very clear cut. And this is an important point. And I'm sure the Global Glyphosate Study, we're following the same principles.
Okay, thank you for this. So another question we received is which are the main methodological constraints of the research done by the industry on which Europe has based to conclude that glyphosate is not a risk for our health? So which are the main methodological constraints? Fiorella, you're muted.
Yes. Yes, I agree. There are methodological constraints because we are following guidelines, above all for carcinogenicity, that do not take into account the present situation. That is no more the industrial carcinogenesis we had in the 80s, with a few people exposed to high doses into the factories. Now what we have low doses spread all over that expose people not from the adulthood, but from the pregnancy of their mother. So the situation is completely changed, and to pursue the rules that we had in the 80s or 90s for carcinogenesis is not adequate for the real situation of humans. But as regard, for example, the reproduction, developmental effects, the guidelines, above all the one of the National Toxicology Program, are more closer to the human situation. And for this reason, in our global glyphosate study, the Arm B is mirroring exactly the guidelines suggested by OECD, integrated with the National Toxicology Program, MOG, the new methods they use for studying the outcome that we are proposing here. So yes, I think that the guidelines of the OECD for carcinogenicity are not sensitive enough to expose the risk that are the real risk for the real life of humans.
Michael, you want to add?
No, not really. I think
Okay.
Fiorella expressed it very, very clearly, where, again, she's very clearly highlighted again the inadequacies of the current health risk assessment procedure. And this is why the Global Glyphosate Study is going to go way beyond that and give us much more real-world reflection of the risks from these chemicals.
Great. So this gives us time for one more question. And we have one. that it said, okay, so it says that the phase 1 of this study was carried out with an ADI applying to the US, not relevant for the EU where the ADI is 0.5 milligrams currently. Therefore, will you be able to complete the study and submit it to EFSA and NECA during the peer review process, which will open in September and will have, it will last for 2 months?
This is the reason I am here. The reason I am here is just to ask for help in order to conclude the arm B of the study and to produce and publish the results about the 0.5 exposure that is just the one of Europe. I would like also to add 2 words about the fact that we are calling for the help of the NGOs, but also institutions are welcome if they want to join us. I remember that to all of you, that we were part of the national system for health up to the first years of this century. And for different political and non-political reasons, now we are a cooperative. But our heart is still the one of the institution. We would like very much to co-work with them. And we are also open to have a scientific committee to evaluate the results, to evaluate the draft of the paper, and to discuss with us the results of this study. We are really open to all that. So don't find any excuse. The Ramazzini Institute is an open institution. We just would like to produce data in order to safeguard the health, our health, and the one of our children and grandchildren.
Thank you very much, Fiorella. I'm becoming aware of the time. Maybe we can stay for one more question because I see we have plenty from the audience. So there is one that says that in your opinion, what more is necessary to convince the European authorities to stop the glyphosate use? Isn't the evidence enough so far? Will this study be key to achieve it? So,
well, for me, if this study isn't enough to convince them, then it shows they don't believe in science. Because what we've done so far with both Fiorella's preliminary study and the joint study we've done with our 3-dose glyphosate Roundup study that I've been mentioning. This is minimally, for me, what this is showing already is that the so-called acceptable daily dose is already wrong. And that minimally what needs to happen is that the acceptable daily intake must be drastically reduced. And only the long-term study is going to show us exactly where if there is a safe limit. At the moment, I would say we don't know what is the safe daily intake level based on the solid science we have already. I would say we don't know what that safe daily intake level is. The Global Glyphosate Study is going to shed more light on that. Is the EU acceptable daily intake of 0.5? Is that really a safe, acceptable daily intake? I await to be convinced, because at the moment, the evidence suggests that it's not, and that we need to revise that daily intake value downwards, especially when we factor in formulations. Again, coming back to what I said earlier, the fact that the regulators are only basing their health risk evaluation assessment just on the long-term studies, just for the active principle. And even those, as Fiorella has mentioned, are inadequate in their evaluations. But let's see what happens when you take an equivalent Roundup formulation dose. different formulations because they have different co-formulants with different degrees of toxicity. There is so much hidden toxicity at the moment that has not come to light because of inadequacy of the work of the studies that regulators use to come to their so-called, the acceptable daily intake. This is, so yes, indeed, I feel that this study more than any should give us the answers to these most crucial questions as to what safe daily intake there is for glyphosate formulations and not just glyphosate only.
Exactly. Thank you very much both for being here today. Thank you, Fiorella, for presenting this study. You have highlighted how important the study is, but at the same time also the inadequacies of the current system to detect adverse effects, especially in the general population, and as you mentioned, exposures during early life, low environmental relevant exposures. It's been very interesting. I hope you receive all your support. You have completely our support. And with this, I want to thank also the audience. I want to thank also the interpreters and everybody on in both sides of the Atlantic for today, attending this webinar. So thank you all and goodbye. Good afternoon and good rest of the day.
I thank you all for attending. All best wishes.